wasn't sure who was out there.
Every time I move.
Right.
Are we on?
Give me one thing to
Okay.
get excited about.
All right, folks, we are going to move into our presentation on the coroner system. So Senator Winthrop, Kelly, I will turn it over to you all to begin. I know you have a couple different speakers today for your presentation.
I'm just going to turn it over to Tori. What I would just say setting this up is just really appreciate the Criminal Justice Commission and the governor's creating this working group. It really accentuates and partners with the work that's happened in the legislature. A group of legislators basically requested our Office of Performance Evaluation conduct a research assessment on the state of the coroner system. And that was presented to our Joint Legislative Oversight Committee, of which I co-chair. It's such an honor to do that with Representative Redmond. And when that information came to the legislature, people were genuinely concerned. And it goes to show we are inundated with information. And while we probably should have understood better the coroner system, this was real eye-opening for all the legislators. And I just saw really great support. The entire Legislative Oversight Committee co-sponsored the very first bill that was passed in decades to really begin to look at the coroner system to improve public safety and justice. And so from those JLOC meetings, those OP reports with this work group, we met, 6, 7 times over the summer and really rolled up our sleeves with a large working group, by the way, to really start to brainstorm. And I think what you're gonna hear today is from Tori, what is the importance of the coroner system and what does it do? You're gonna hear from our Office of Performance Evaluation. They're gonna talk about that, give you a brief overview of some of the conditions and gaps that exist. And then I'm going to follow up with some of the big picture recommendations and where we're moving, and then hopeful that this commission will support some of those recommendations from the governor. Yes, sir. Tori, our coroner from Bannock County.
Yeah. Thank you, Senator Winthrop. I'm Chair, Commission. My name is Tori Danner. I am the coroner for Bannock County. I also participate in the IAC Coroner subgroup as well as the legislative subcommittee for the Idaho State Association of County Coroners. Here we are. Okay. All right, let's dig in. Let's take a moment and walk through how the Idaho Coroner System works. First, we'll start with jurisdiction. And Idaho coroners operate at a county level. Every county elects its own coroner, making this an elected position that is accountable directly to the local voters. Coroners serve 4-year terms, just like several other county level elected officials. Now, when it comes to requirements to become a coroner in Idaho law is pretty simple. The person must be 18 years of age and a resident of Idaho, and that's it. There are no additional requirements such as medical background or law enforcement experience. As a result, coroners come from a wide range of professional fields. Because of the limited entry requirements, training becomes especially important. Idaho statute mandates participation in coroner school, which must be approved training by a nationally accredited association. This ensures coroners receive the necessary foundational education to perform their duties. Additionally, the Idaho State Association of County Coroners has approved 3 training opportunities that are eligible for reimbursement, 2 available online and 1 in person. This is to help ensure that coroners have flexible options to get the trainings that they need. Next slide, please. What coroners do. Coroners are tasked with multiple critical duties. The most publicly visible of those is providing the cause and manner of death on cases that fall under coroner's jurisdiction. An unrecognized role of paramount importance is that safeguarding the community in which they serve. Medical legal death investigators can identify public health risks as they support law enforcement efforts in the type and direction of the investigational process. The community safeguarding starts with the medical legal death investigation that fall under their jurisdiction. These cases include those of forensic nature or unexplained deaths. Examples of forensic cases are homicides, suicides, accidents, or deaths of suspicious nature where the circumstances surrounding the death are unknown. Many in the public do not understand that a thorough medical legal death investigation is essential for the forensic pathologist in determining the cause of death. Next slide, please. Why it's important. Ongoing threats to the community, the coroner's office investigations often will expose dangers that have claimed life of a victim. Additionally, the coroner's office may also expose hazards that pose a continuing threat to others. These include unrecognized carbon monoxide leaks, electrical hazards, communicable diseases, animal attacks, unrecognized homicides, and unsafe environments. Sharing these with the community stakeholders helps prevent additional deaths and contributes to the overall public safety. Public health surveillance. The coroner's office collect, and provide data on deaths within their jurisdictions. This valuable information is used for public health surveillance and identifies patterns of disease, trends in mortality rates, and emerging health threats. Mental health surveillance. The coroner's office also monitors and reports on possible mental health crises. Most notable is that of the clustering of teen suicides. Upon identifying the potential crisis, the coroner will reach out to public health officials, school systems, and mental health professionals to address the issue and prevent additional deaths. Supporting and participating with law enforcement. Coroners work closely with law enforcement, even though their investigations remain independent. Findings revealed during the coroner's scene investigation or an autopsy could change the entire direction of law enforcement's investigations. Partnering can provide and preserve a crucial evidence in criminal cases. These not only lead to successful prosecution of criminals, but also prevent unnecessary expense when no crime has been committed. Moreover, it contributes to the public safety, but also helps conserve taxpayer dollars. Mass disaster preparedness. Mass fatality incidents are defined as any incident resulting in more fatalities that can be repeatedly managed by the local medical legal authority. By understanding their jurisdictional responsibility, coroners have the opportunity to reveal the importance of recovery operations to the incident and the community. In response to mass fatality incident, the coroner must execute and oversee an array of operational tasks, including but not limited to scene investigation, documenting and recovering victim remains, and the evidentiary items at the disaster site, developing and implementing fatality-related public communications, plus more. Next slide, please. Inconsistency. We utilize a variety of methods for collecting and storing our data. To enhance our processes, we should aim for a greater consistency in how we collect, secure, and share this information. Implementing standardized practices can help improve our overall data management and collaboration. Education. We have varying levels of education and experience across the state. We are committed to closing the gaps in our current model as we strive to uphold sustainable national best practices in Idaho, inspiring positive change for our community. We want to bridge the consistency of how death investigation is done in our state. So, let's go back up.
Thanks, Tori. Appreciate it. So I have asked, we have a couple presenters on this topic. So I have asked that maybe we can just hold the questions till the end and then do a little round robin style.
Perfect.
So appreciate it. Thank you.
Thank you.
So you want to go to the next slide? Yeah.
Good morning. My name is Ryan Langrill, and I am the Director of the Office of Performance Evaluations, and I'm mostly here to introduce Casey Petty, who will be presenting the findings from our 2024 report on the coroner and death investigation system. So as an introduction, the Office of Performance Evaluations is an independent office of the Idaho Legislature that reports to the Joint Legislative Oversight Committee. One of our co-chairs, Senator Wintrow, you know quite well. So the Oversight Committee asked us to look into the coroner system in March of 2023. We then spent the interim working with coroners across the state to identify how the system is working and where it's not. And during the 2024 session, our report found that, and Casey will go into much more detail, but that really in Idaho, it matters where you die. It matters where you die, and depending on what level of service you're going to get from the investigation of that death and whether any sort of medical legal thing will be found in the coroners. So our committee, for the first time that I'm aware of, during this most recent session, each member of our committee co-sponsored Senate Bill 1101, which helped to address some of the findings in our report, and that was passed this most recent session, and that was just the first step in what is many more steps to get our death investigation system functioning the way that Idahoans deserve. So with that, I'll turn the time over to Casey Petty, Principal Evaluator and the person who did the work.
Yeah, thank you, Ryan. So we'll actually go back to the first slide. Oh, yeah, there we go. So in this report, I'm the one that worked on this. I reached out to the different county coroners. I looked at Idaho code. I looked at the state code for the other 49 states and Washington, D.C., and I tried to create a baseline of how Idaho is operating in comparisons to other states. And quickly what we found was is our coroner system was very fractured and diffused. It was relying on code that was written in 1864 under the Idaho territorial laws for a lot of the duties for coroners. So we're talking like 160 years old, trying to dictate something in 2024, which is kind of wild. And next slide. As Ryan mentioned, so in the 2025 legislative session, the legislature passed Senate Bill 1101, and this addressed a lot of the concerns that we had in our reports. A big one is it expanded the types of deaths that are reportable to a coroner. Prior to this, Idaho ranked 41st nationally in the number or the types of deaths that need to be referred to a coroner for investigation. They were very broad and vague. It was things like suicide, accident, homicide. And so there was a lot of fringe cases where deaths probably should be reported to a coroner and they were not. Another change was it placed the decedent under the jurisdiction of the coroner. One thing that we heard frequently was that coroners believed that the decedent was under their jurisdiction, but then they would get to a scene of a death and law enforcement may have removed like ropes or bindings or altered the scene, which could impact their investigation. Senate Bill 1101 makes it clear that the decedent is under the jurisdiction of the coroner, and law enforcement or other individuals may not move the body until the coroner is notified. And then last, it provided clear definitions for the medical legal death investigation system. There were some things like what an unintended death is that were very confusing. Essentially, an unintended death is a death that is not attended by a physician. Those deaths are supposed to be reported to a coroner, but there was no clear definition. And so some coroners believed that an unintended death meant that someone hadn't seen a doctor in the last year. Some believe that an intended death meant that the individual was at end-of-life hospice care. Now, Senate Bill 1101 clarified that it is if you have not seen a doctor in the last month, or if you've been admitted to a hospital unconscious and you pass away before regaining consciousness. So essentially, Senate Bill 1101 did a lot to address a lot of the ambiguities and the vagueness in our system, but there's still a lot of recommendations in a report that need to be addressed. Next slide. Which is what I just said now. But yeah, and so what I'm going to do is I'm going to go over some areas of our report that additional work still needs to be done. And next slide. So there's 28 states nationally that have coroners. Most of them are county coroners. Kansas uses a regional coroner system, but essentially their duties are the same in all 28 states. We found of the 28 states, Idaho is one of 8 that does not provide any sort of state level oversight for the coroners. So typically the state level oversight could be a state medical examiner, coroner boards, or a coroner training board, or state oversight board, something similar to POST. Essentially what this means is that in Idaho, coroners are operating on their own. There is the Idaho State Association of County Coroners, which is a non-government entity that they can go for support. But as far as oversight, there's zero. And so because of this, we found that the fidelity of investigation practices vary county by county because there's no one really holding them accountable and ensuring that, one, they receive the same level of education, and two, that they are upholding the same standards. Next slide. As far as education goes, so Tori mentioned that it is a requirement that coroners participate in education when they're first elected office, and then also 24 hours of continuing education every 4 years. However, we found that this was not the case in 2023, I think it was. Only 41% of elected coroners participated in that 24 hours of continuing education that they are required to partake. We found that, again, there's no state oversight for education. Of the 28 states that have coroners, 23 require coroners to complete education. Idaho is one of 3 that has zero oversight of education to ensure that the coroners are actually completing the education. Most coroner states will have some sort of consequence for coroners who fail to complete the education. Off the top of my head, Wyoming, it's a misdemeanor if you are an elected coroner and you do not complete your education. Some states will remove you from office. Some states will dock pay. In Idaho, there's zero accountability, and as such, we're seeing very low participation rates in coroner education. I will say Senate Bill 1101 did clarify what constitutes education. Prior to this, it was very vague. It was coroner school. No one knows what coroner school is. Now it is identified that it has to be nationally recognized coroner education. But again, fidelity isn't great on the education. Next slide. A big thing is death investigation data practices. Most states, there is information in state code around what information can be shared that is collected during an active death investigation. Idaho code, for example, prohibits law enforcement from sharing information during an active criminal investigation publicly. That does not extend to coroners. And so coroners can share information as they see fit. We saw this recently with a high-profile murder case in northern Idaho, where there was an active investigation going on, and the local county coroner went on national news and was describing how the bodies were found and the weapon that was used. This is completely permissible under Idaho code because, again, there's nothing in state code that prohibits coroners from sharing information that is pertaining to an active death investigation. We found that the tools that coroners use to store death investigation information vary. So Ada County provides every county in the state with a software tool known as MDI log that allows them to track death investigations. Most coroners do not use this. Instead, they use very informal handwritten notes, if at all, for their death investigations. And we've heard that many coroners will store death investigation information at their home and potentially a locked, just cabinet in their home, which can create issues if there is a new coroner that is elected, and how does that information get moved. But essentially they're inconsistent, the tools that they use, but Ada County does provide every coroner in the state with an online tool known as MDI log. But most coroners are not using it unless they are trying to get an autopsy done. And then finally, coroners, we've heard, do not always share information with other bodies. A big one is the Child Fatality Review Team, which is tasked at looking at child deaths. We've heard that there are some coroners that have repeatedly denied sharing information with the Child Fatality Review Team and will not provide death information or death investigation information. Additionally, there's different online databases that Governor Little would like coroners to participate in, one being OD Maps, which tracks drug overdoses in the state. This allows the state to track drug overdoses and see where the hubs are. Unfortunately, again, coroners are not required to submit this information, and it is very inconsistent, and most do not submit this information. Last thing with data practices is there's zero regulation on how long or how death investigation data should be stored. And so some coroners do have investigative records going back, 30, 40, 50 years because they don't know if they can purge it or not. And so again, Idaho Code is extremely vague on data practices for coroners. Next slide. Okay, and then other outstanding recommendations. One that I'm going to get into a little bit later is no deaths in Idaho are required to be autopsied. National organizations like the National Association of Medical Examiners, they list about 15 different deaths that should always be autopsied. Idaho, we have 0. It's completely up to the discretion of the coroner, or in some cases, the county prosecutor. And then last is the handling of remains for religious and spiritual purposes. Idaho Code is extremely vague on how to handle a request from a family requesting for there not to be an autopsy or for a decedent to be released to the family. And so this creates a system where each coroner office has to come up with their own policy on how they are going to handle objections to autopsies. This creates an issue because when you're dealing with religious and spiritual domains, you can violate an individual's First and 14th Amendment rights. We're seeing this currently in Northern Idaho. There's another county that is being sued because they did not release a decedent to her family in time so they could undertake a religious practice. And so essentially it's because there was nothing in state code that said that, that this coroner is justified in not withholding the body. And so each office has to come up with their own policies, but then these policies are not vetted at a state level and could violate individuals' constitutional rights. So again, that's still a big gap and needs to be addressed. Next slide. I think the next part, we're gonna get into funding and resources. This is a big one. So coroners are county elected officials, and there is a $1 surcharge on all death certificates, but that is to go towards coroner education. And so it's really the individual counties themselves that have to pay for all resources and coroner salaries. Next slide. And then this one actually has like 3, so you can just click through really quick. Yeah, perfect. And so we heard from a lot of coroners, and we did a follow-up survey after our report about access to resources. And we heard that a lot of coroners don't have offices. So instead, they have to work out of their homes. If they have to meet with a family of a decedent, oftentimes this needs to be in a public place, like a grocery store parking lot, we heard, or a library. Coroners mentioned that they often do not have access to basic equipment, such as a computer or a camera. And so they have to use their own private property to do that, which opens a lot of issues around public information requests. And then last, most frequently, we heard that coroners don't have a vehicle to transport decedents or a cooler to store decedents. And so instead, they either have to use their own vehicle, like we've heard stories of a county commissioner telling a coroner to transport a dead child in the backseat of their car to get an autopsy, or they have to rely on expensive third-party services, which break the chain of command, which could open up potential problems where, you know, someone could have access to a decedent prior to an autopsy, which you're not supposed to do. So again, vehicles is a big thing, and also coolers. Next slide. You can click again, there's gonna be, so coroners we found have the lowest median and average salary of all county elected officials in 2022. Coroners are typically part-time, but they have to be available 24/7 because deaths can happen at any time. We found in 2022, the median salary for an elected coroner was $17,969, less than half the next closest of county commissioners at $38,000, which county commissioners are often part-time as well. And then the average salary was just over $30,000, and the next closest was commissioners at $49,910. Of the 44 counties, coroners had the lowest salary in 42 of them. There were 2 counties that the coroner and the county commissioners were paid the same. And so in every county, they had the lowest salary or tied for the lowest salary of all elected officials. Next slide. Additionally, low pay can be a barrier for recruiting, retaining, and training deputy coroners. So statewide in 2022, there were 73 deputy coroners. Their median salary was $8,788. However, this is heavily skewed by the largest counties. So I have the 6, is that 6? Yeah, the 6 largest counties listed there and the number of deputies that they have in their median salary. Bonneville is a bit of an outlier. I don't know if you guys have followed the news. The Bonneville coroner recently resigned back in December. So they're a bit of an outlier for the larger counties. But if you subtract all the largest counties and just look at the smallest 38, in those 38 counties, there were 41 deputy coroners with a median salary of $4,000 a year. Deputies are obviously very important because, again, it's a 24/7 job. If a coroner needs to leave their county because they have to go to Ada County for 2 days for an autopsy, they need a deputy to fill in and kind of man the area. With such low pay, $4,000, it's extremely hard to find someone who's 1, qualified to do the job, and 2, willing to put in the hours and the time to get trained and certified. And so we found, again, very low standards, no standards really for deputies, but then just typically it's very difficult to recruit qualified deputy coroners. And then last, we'll end up with autopsies. And so essentially, I'm assuming everyone knows what an autopsy is. It's done by a forensic pathologist. It's to determine the cause and manner of death. And autopsies are very important, especially in a state like Idaho, where the coroners, there's 0 education requirements to become a coroner. And so it'd be like me off the street trying to determine how someone dies. I don't know. So I'd have to rely on a forensic pathologist to do an autopsy to ensure that there's no foul play and to determine the cause and manner of death. Next slide. So autopsies in Idaho are performed at the discretion of the coroner or the county prosecutor. I think there's actually, and then so yeah, name recommends 13 situations where autopsies should be performed. Many coroner states require autopsies for some deaths. Most frequently are those like children who die from unknown causes, so without a known medical disease. And then also individuals who die in police or state custody. Those are the 2 most frequent that you'll see in other state codes. But again, in Idaho, autopsies are entirely done at the discretion of the coroner, or again, in some cases, the county prosecutor. And then this one has a few. I think that's 3, yeah. So there's some factors that we found that can influence the odds of whether or not someone has an autopsy. The biggest one is the age of the decedent. If you are over 65, you are not going to get an autopsy. It is extremely unlikely, regardless of the circumstances of your death, you are likely not going to get an autopsy. Second is who certifies the death. So there are like 4 different professionals that can certify a death certificate. 3 are medical, and then the coroner. We found that coroners are much more likely to have an autopsy be performed than medical professionals. I unfortunately don't have the numbers memorized, but so 94% of autopsies that are done in the state of Idaho are overseen by a coroner, even though 20% of deaths a year in Idaho are certified by a coroner. So again, it's just very important that the deaths that are on the fringe that, they're unsure about how someone died, that those do get referred to the coroner for a medical legal death investigation. Because again, most likely if the death is certified by a medical professional, they are not going to be autopsied. And then the last one is the location of the death. When we did this report, there was only 2 counties in the state of Idaho that were performing autopsies. There was Canyon County, who had a hospital pathologist that would do autopsies for themselves, and then also for Hawaii County. And then there was Ada County that has 3 forensic pathologists that would do autopsies for the bulk of the state. And then there was 8 counties in northern Idaho that would go across the border to Spokane, Washington for autopsies. We found, because of the distance, counties in eastern Idaho and central Idaho, which were anywhere from 3 to 6 hours away from Ada County, were much less likely to do an autopsy than those that were closer to an autopsy center. Again, this is primarily probably fiscal reasons. If you are 6 hours away from Ada County and you have to spend, a day driving to Ada County, a day driving back, you have to get a hotel, you potentially have to pay $3,000 to some transport to transport the decedent. And then you have to, on top of that, pay $2,300 for the autopsy. You're looking at anywhere from like $6,000 to $7,000 for an autopsy, which can be very expensive. And for a lot of these small rural counties in eastern Idaho, that's a lot of money. Next slide. And so this is the autopsy rate of all deaths between 2018 through 2022. I do want to emphasize that this is not just deaths that are certified by the county coroner. This is all deaths. And we found that 3.9% of deaths between 2018 and 2022 were autopsied. Counties spent an estimated $2.8 million on autopsies over this period. Again, that is because only Canyon and Ada County are performing their own autopsies. They're paying other counties to do the autopsies, and those costs range anywhere from $1,800 to $2,300. And then, like I said on the map, if you see like eastern Idaho, it is very light because they have low amounts of autopsies. Next slide. We found that nationally, Idaho ranked 49th of 51 for the percentage of deaths that were autopsied from 2018 through 2022. The Idaho rate was 3.9%. All coroner states, so the 27 other states autopsied 8% of deaths, and nationally 7.8% of deaths were autopsied. So Idaho is autopsying about half as many deaths as other states. Concerningly, though, there were some types of deaths where Idaho ranked last. So one being child deaths from external or unknown causes. So these are children that, again, died without a known medical disease. And Idaho autopsied 49% of these children compared to 79% in all other coroner states and 79% nationally. And that 49% was well below, I think, the 50th state by a fair margin. And so we're not autopsying a lot of children. Next slide. And then last is deaths from homicides. So national standards recommended about 95% of deaths that are suspected homicide should be autopsied. Again, we found Idaho autopsied 92% from 2018 through 2022, which was the lowest in the country. There's only 3 states that were below that 95%, and Idaho was the only coroner state that was below that 95%. And nationally, 99% of homicides or known homicides are autopsied. There's known cases in Idaho where someone was murdered and was not autopsied. But, and so of known homicides, we're only autopsying 92%. And then this is my last slide. And these are barriers to increasing autopsy rates. The big one is Idaho at the time did not have enough forensic pathologists in the state to bring up the autopsy rates to national standards. There are limits on how many autopsies a forensic pathologist can do a year. I think IAC says it's about 250. And again, we're a state that had 3 forensic pathologists at the time. So we had a theoretical cap of 750 autopsies. I have heard from the criminal justice or the coroner subcommittee that there are 2 forensic pathologists in training that want to participate in Idaho, and I think Senator Wintrow might get into that in a little bit. But again, that is a barrier. The three highest paid county employees in the state of Idaho are the three forensic pathologists for Ada County. They get paid anywhere from like $250,000 to $400,000 a year. Very expensive, and they're very hard to recruit because they're needed nationally. So this isn't just an Idaho problem. Next is just the funding in general. So again, since there's only 2 counties that are currently doing their own autopsies, all other counties need to pay to have their autopsies done. We estimate it would cost anywhere between an additional $1 to $2 million more a year from county budgets to pay for additional autopsies. One thing that we have seen in other states, such as Washington or Kansas, is the state will step in and reimburse counties on the costs of autopsies and also on transportation costs for autopsies. And this is typically done in a manner to get specific autopsies done. So for example, in the state of Kansas, they will reimburse autopsies on children because they want to encourage coroners to have autopsies done on children. And then the last barrier is, again, the distance. Counties in eastern Idaho are over 4 hours away to the closest forensic pathology lab. When we initially did this report, there was talks of a eastern Idaho lab opening up that fell through. But now I believe that there's talks in northern Idaho, and Senator Wintrow might speak on that more. So we could potentially be getting a new lab in northern Idaho, but we still have that gap in eastern Idaho. And again, I said this earlier, but it is a pretty heavy lift for those counties in eastern Idaho to get an autopsy done because of the distance to Ada County. And it's often a 2-day thing. And so not only do they have to transport the scene over here and transport back, they also have to cover, food and lodging. And a lot of counties, these smaller counties, their coroner budget is like $10,000 a year. And if you burn through $6,000 on a single autopsy, that's like your entire budget. Yeah, and that is the end of my presentation. Yeah. So.
Do you all want me to go over there, or do you want me to present from here?
Completely up to you. There is great if you want to see.
Oh, okay,
Fine.
I'll just take it.
Yeah, however you're
Well,
most comfortable.
I don't think I can walk after that presentation. Thank you, Casey. Really good job, and Tori. So I saw some looks on your faces as Casey was presenting, and Christine was right in her sight. Go to the next slide. There are many gaps, and short of constitutional amendment, this group is looking at how do we utilize these recommendations and the identification of those gaps and moving forward. And one of the biggest things that has been discussed over and over by Casey was a lack of state oversight. Now, that can be solved. We could amend the Constitution and we could, put together the budget, which would be substantial. And so until that would happen, we are looking at what can we do to make incremental changes that really have positive impacts on public safety and justice. And as we heard from Tori, we heard from that report, the coroner system, as played out, is an important part of criminal justice process, identifying health issues in our region, looking at things, like we said, as far as drug overdoses, the fentanyl crisis, like where are we seeing that map out? Really important role in that system. However, again, going back to that previous presentation, the challenge we have in our state is it's predominantly rural. And so we see where the largest tax base is where the services are provided, and then everyone else has to come in and pay the largest tax base a fee to get that done. And as we saw in those challenges and barriers, it's hard to do. So some of the recommendations or solutions this group is looking at is, in our last meeting, we said, hey, I think we have gone through a lot of these gaps. We need a strategic plan to say, how can we incrementally solve these every year? Because if we were to do all of them all at once, it would break the bank. And all of the things that the coroner system needs financially will be competing with all the other interests. So I think it is important, and this group is trying to develop a strategic plan. We have coroners, county commissioners, law enforcement, prosecutors. We have great representation as we go forward. And so my hope is maybe in the next meeting, we might have a draft of what we're starting to look at, what that would be. So incrementally what we can do. Go to the next slide, it might help me there. So this is just an example. Something we talked about in our working group was, again, looking at that OP report, creating metrics and a timeline as far as how to meet them. And this would be a great way that we can measure those outcomes and really create a little bit of accountability as we move forward. Because as I saw the looks on your face, it's overwhelming. I think all of us, if we had a magic wand, we would kind of place it, but it would take significant resources and work from the organization. So I really like this idea of the strategic plan. And then what we have been doing is utilizing the Joint Legislative Oversight Committee and now the Governor's Criminal Justice Commission to do reports weigh in. How are things going? And let's keep checking. And how can the legislature keep supporting these efforts, right, in our communication and collaboration? So it's really nice to see the executive and legislative branch working that way. Go to the next slide. I kind of forget what's in there. Okay. We heard a lot about inconsistencies. And it's not just inconsistency in reporting, it's just inconsistencies in general, right? Whether it's, I wrote down a list, finances and equipment. Where's my office? How am I storing records? Privacy of individuals. Certifications, right? So we're identifying what needs to happen, but we're recognizing what's the accountability piece. And so one of the solutions we have been discussing is a model similar to like Post Academy, Brand Board, Racing Commission, right? Or we could create an advisory group of the stakeholders that are closest to this issue, whether it's commissioners, prosecutors, it's kind of similar to the working group, heavy on the coroners, right? To basically provide some guidance and accountability to the entire state. So in a lack of statewide office, maybe a group that has, that are, the appropriate stakeholders to help with a governing piece of that, right? And again, that's a good model because it keeps people who are in the trenches in the work and knowing everyday things that are happening in that governing strategy to make sure we're holding each other accountable. What I've noticed is that as I meet coroners and we talk about this statewide, the folks who have the resources are doing, more, right? And a better job. And there is frustration I've sensed among the coroner system too, of folks who say, we need to do this more professionalized system. How do we hold each other accountable in an elected position? Now, we heard some recommendations. We've talked about misdemeanors and those kind of things, but the larger recommendation, I think, is if we can create this advisory governing group and go to the next slide. Let's see if it brings it to me. No, go back. We can actually put resources that are governed by this group to then distribute out to counties, right? So this is once again that issue where we have the counties mandated to do something and they just don't have the funds and resources. So what is the state's ownership in that and partnership? We got to negotiate that, but also could we create a governing board that helps? And if we actually find the resources to put them in there, we can distribute them. I'm going out of order with my slides, but that's my fault, not Kelly's. With that advisory board, one of the other recommendations is that, as you heard, a resource issue. So short of the legislature giving us a few $1 million to start out with, one solution would be to look at the death certificate. We haven't increased that fee. You can go, yeah, there you go. We haven't increased that fee in a long time. And if we took even a little bit of that fee that we could put toward this group, you're seeing here, we would get about $80,000 to $90,000 per year. Now that's not going to cut the mustard, is it? What we do know sometimes about our legislature, though, however, is that if we can demonstrate some funding that has some sustainability, maybe it's not $1, maybe it's $2, maybe it's $3. What is the legislature's appetite in increasing the fee so it's not too exorbitant for folks or, sends them into shock? That would put a little bit more money in the account, as well as sometimes I know as a legislator, if I see that happening, I might match some funds, right? So maybe there's an opportunity to negotiate with the legislature to say, hey, if we can find a sustainable funding stream here, maybe there's a match you could provide to kind of infuse some energy into the system and keep us moving, right? But if we had this governing board, that would put the money into place, and then counties could request funds for autopsies, resource, supplies. The state police has been very good. They're part of our working group, identifying, ways to help partner and bring resources into the system. But again, what Casey told us is that finances are limited to people. And so if we could infuse the money there, we also incentivize the behavior. And so it's the carrot or the stick. So if we could continue to try to provide some incentives to change the behavior, then when we do need the stick, it'll be there. But let's get everybody, let's not just start getting people because they don't have the resources, right? Let's try to incentivize the behavior to get them there. I think that's been the mentality of the working group. So, addressing some of these inconsistencies, looking at an advisory board to do so, creating a strategic plan to look forward incrementally how to make those changes, and then also discussing these funding opportunities that will produce that. Go to the next slide. Sorry, I'm going out of order, y'all. We kind of talked about the partnerships in the state again. I think one thing, it's not a surprise. Even last year, we talked about this. How can the state help here? Because we as a legislature create laws for the counties and require them to do things. And so how can we partner on that? Because we see this as vital to public safety, especially child deaths, right? We're not doing this like we should. And we can't let a resource issue get in the way of that. Okay, next one. We talked a little bit, another recommendation was facilities. So you heard Casey talking about that. We have a member of our group from Kootenai County, and they're actually on the right path and a road to create a facility so they can do the northern part of the state. Ada County is over here, southwestern, and we see the gap in east. We have been investigating some options. So our team went out and did some research, and there might be some possibilities with a hospital that way, as well as the state police has some, opportunity to partner on potentially with Colonel's Plus and what it would cost to add at the state police forensic center, right? So what we're trying to do is say, instead of having to build a whole facility, what exists currently that could be added on to, so it would decrease the amount of money needed, but also it's in the right place and a resource for folks to do autopsies in that part of the state instead of traveling. So those options are being examined. And as we examine the facility part, as you heard Casey say, we've gotten some emails from some people pretty passionate about finishing their pathology, their schooling, and coming to settle here in Idaho. And so we're kind of coming to a perfect storm here. So if we can find a solution about where to put them in an affordable way and pay them, we're going to start working on our workforce issue there, right? So that's really exciting that people are actually, we had a couple reach out to us. So we have to capture that opportunity in the funding process as well as the facility. Next slide. Was that it? Oh, and then last, I skipped the question. One of the inconsistencies that you've heard about is the records issue, right? And how we're sharing records and photographs and so forth. So last session, when we were working on the bill that we passed, there was a concern raised very late about the confidentiality of decedent photos. Mm-hmm. And it was during the session, we tried to address it, but as you well know, session's chaos. And I put a bill forward, it was the wrong bill, it would have harmed more than do good. So I pulled it back and said, hey, we don't push bad legislation. We gotta work this out. And so I gotta tell you, I thought deceiving photos would be easy. It's more complex than one realizes. And so I have drafted legislation, I have given it out to stakeholders to protect the confidentiality of the deceiving photos. Because we've seen recently in some cases where those photos have been released to the public, and not many people were happy about that. So we are weighing, currently I've distributed that to a lot of stakeholders, because what we're weighing is the essential importance of dignity for the person that has died, right? We want to make sure we're protecting that at all costs. And most of the public really doesn't want to see a deceived photo. Even the press corps was not pleased, right? So in the legislation, it talks about not releasing those photos, active or inactive case, because we know with death penalty cases and other homicides, they're appealable. We can't release photos there. The tension that we're dealing with is that some of the community members would like to allow access of the deceiving photo for families.